Hi, everyone. This is Inga Hansen, editor of MedEsthetics magazine. Thank you so much for joining us today. We are going to go ahead and get started with today's webinar. If you have any questions during the presentation, please type them into the box on the right-hand side of your screen, and we will answer them at the end of the webinar. Today, we'll be discussing how to integrate one-step, laser-based autologous fat transfer into your practice. This webinar is sponsored by Alma Lasers. Our presenter is Jeffrey Hsu, MD, board-certified dermatologist and co-founder of Oak Dermatology, serving the greater Chicago area. Welcome, Dr. Hsu.
Thank you, Inga. Thank you for the generous introduction. My name is Jeffrey Hsu, and I'm a dermatologist in the Chicago area. And I want to thank everyone for taking the time in the middle of the day to join me. I know many of the attendees are curious, but maybe somewhat intimidated by the process of fat harvesting and fat transfer. So I want to share my personal journey of rediscovering fat grafting and how I incorporated this procedure into my practice. Well, first of all, what is fat transfer? Well, it basically is taking fat out of where you don't want it and put it where you do need it. Now, it can be the face, it can be the buttocks, or even the breast. And keep in mind, this has to be a very gentle and delicate process because we want to harvest live and intact fat cells. Now, why do we need to do this? Well, this is an ideal alternative to synthetic fillers that we use every day. This will address large volume loss where using conventional fillers is not cost effective. And this will also bring your patients natural, long-lasting results. Now, why this sudden attention to fat grafting? Well, it's really not new. This idea has been around for a few decades, but I think it's always been a concept that's ahead of its time. But the aesthetic market is finally ready for this to take off. I think in part because fillers is now commonplace. If you look at this diagram, you'll see that injectable fillers is the number 2 non-surgical procedure, both in men and women, almost $500 million a year spent on it. So many patients are aware of the benefits of restoring volume. And many of these patients are ready for something natural, something long-term, something that's economical for large volume filling. And another trend is that liposuction is now the number 1 surgical procedure in men and number 2 in women. We're now spending about $1 billion a year just on liposuction, and that number is increasing. So all these people will have the option to use that fat that we take out. So right now, autologous fat transfer is already a $283 million market each year, and industry data is predicting that this will balloon into a $4.2 billion market in as little as 3 years. So the market opportunity is tremendous. Now, many of you are probably curious about it, but thinking, well, maybe this is not for me. So let me talk to you about my personal process. Now, I'm a dermatologist, and yes, I was exposed to liposuction during residency and during fellowship, but that was 15 years ago, and I was never a big fan. Why? Because first, I had no interest in doing large case liposuction. My lasting memory of fellowship was my fellowship director slaving over patients for 3 or 4 hours at a time, sweat pouring down his face, his shoulders wrecked, and him just exhausted after each case. I'm not interested in doing that. And 2, it was just seems like a cumbersome and complicated process. If you look at that stack of equipment to your right there, that's why I need to do a fat graft. We need a device to infiltrate the tumescent fluid. We need a device to aspirate the fat. And if you choose to use a laser to facilitate the process, you need a laser device. And then you need something to isolate the fat from the fluid. And then on top of that, you need a setup to re-inject the fat. It was actually a pretty daunting process. So I said no thanks to that. But Number three, and this is probably the most important factor for me, I learned in fellowship that for fat transfer, no matter how meticulous your technique is, you will still get unpredictable results. And back then, we probably didn't know this, but that was in large part due to how we harvested the fat and the quality and the viability of the fat. So my patients would spend all this money and effort, and sometimes they had great long-term results, but oftentimes they will come back in 3 months and it's all gone. So I couldn't really look in the patient's eyes and say with honesty that I'm confident that most of your fat's going to stay and it's going to become a part of you. Just couldn't do it. And lastly, what is your time spent on this process and what's your return on investment? Again, this is with the assumption that this process took hours and hours every single case. So when fillers became commonplace, I, just like everyone else, thought it was financially more rewarding to do fillers. So for all those reasons, I really didn't get into fat grafting. But please keep all these issues in mind because we're going to circle back to them and address all of them. Now, furthermore, if you look at the devices that allow us to extract fat, none of them were ideal for preserving fat. The original method was, and still is, manual liposuction, where with manual movement and with some suction, we're basically tearing and ripping the fat from the surrounding stroma. Well, certainly it's traumatic and not good for fat reimplantation. Now, what about power-assisted liposuction? Now, this is where the cannula sort of gyrates and stabs the fat, almost like jackhammering the fat, right? It was very aggressive. Patients typically experience long downtime, and patients are swollen for months. And the quality of the fat and the viability was not consistent. And then we have ultrasound-assisted liposuction, which is not great either. If you look at this clip over here, you're basically vibrating and heating the cells into mush. So you're not really harvesting live cells for reimplantation. And lastly, we have what seems to be worse to me, which is the standard laser-assisted liposuction. Now keep in mind that this is very different from the BeautiFill laser. The standard liposuction fibers are bare laser fibers, super high energy, super hot, and just cooks and fries and cauterizes its way through fat. In fact, it can be dangerous in the wrong hands because you risk perforating vital structures and organs. And the quality of the fat obviously could be a problem given all that heat trauma. So clearly, most of the extraction methods were for large-scale destruction and removal of fat. They're not really designed to preserve them and to keep them alive. Now, some providers will add the additional step to process the fat, like centrifuging it to isolate the fat cells. But they may simply be traumatizing the fat cells even more. And the poor quality of fat accounted for historically inconsistent results. So what made me look at fat transfer again? Well, again, this is my personal experience. Now, I'm blessed that I'm doing well. I have patients that booked out for 4 weeks, and many of which are filler patients. But I'm also becoming frustrated, and that's slowly building up over the past few years. I'm frustrated because it is hard to stand out anymore as a facial injector to distinguish myself from the pack. If you look on social media, Instagram, Facebook, and so forth, and then every clinic's website, it seems like that everybody is an expert injector, right? Everybody is a world-class master injector. Whether you are an esthetician that's done 2 syringes of fillers in your entire life, or a 15-year experience, fellowship-trained, board-certified dermatologist who's done 10,000 syringes, we all look alike online. We're all offering the same services. We're all offering the same products. Right? And I don't begrudge the esthetician or the nurse injector for honing their craft. I think it's great that we all get to rise together. We all get to help the patients together. But I do need something that's unique to me, to my surgical experience, and to my expertise. I wanted to take myself to another echelon. So when I heard about the BeautiFill device by Alma, an automated, all-in-one fat grafting system, I thought, well, maybe this is it. This is my chance to re-embrace the fat. Right? So then I flew down to Texas and attended a training course provided by Alma. And I have to say, it was a very comprehensive course. So here I am back to being a student again. We started with didactics, understanding the basics of anatomy, tumescent anesthesia, and the basics of fat harvesting and fat reinjection. And then we began to do a live demonstration where I learned that if fat grafting to the face is your goal, harvesting 75 or 100 cc's of fat is a fairly simple and quick process. It takes 15 minutes at most to infiltrate the lidocaine, the tumescent lidocaine. And mind you, this is done with the patient completely awake and non-sedated. And what I was really surprised by was how quick the liposuction or fat harvesting part was. It really only took 20 minutes. And the BeautiFill device, while you're doing the harvesting, will automatically clean, filter, and isolate the fat from the fluid. So all you have to do at the end of your harvesting process is to take that canister, put the fat in a syringe, put on the cannula, and inject. And the injection part you already know, because I'm sure most of you do fillers. Now, the injection part is very similar to injecting fillers with the cannula, with some key differences. I mean, this is the part that takes the most time and artistry, because you're no longer injecting just a couple of cc's of fillers. You get to treat the entire face. So that took a little longer, but with the right technique, there is actually very little trauma, very little bruising. If you have any surgical experience, if you are a general surgeon, if you are a dermatologist, if you are an ENT surgeon, if you're OB-GYN, this is an easy learning curve for you. I definitely do not be scared of the fat harvesting part of it. Now, a little bit more about the device itself. The BeautiFill device is an all-in-one, automated, complete device for fat transfer. It has the infiltration pump built in for tumescent anesthesia. It has an aspiration pump for harvesting. It has a laser unit which sits on top. That's very different from the standard laser-assisted liposuction, which I will discuss in more detail. It has a filtration system that isolates the pure fat from the oil and the liquid. And it comes with all the harvesting cannulas and injection cannulas that you will need from beginning to end. So now let's talk a couple of minutes about the laser itself. Now, this is a 1470 nanometer laser, which is an integral part of the BeautiFill process. Why 1470? Well, let's think about the bigger picture. Right? If we want fat to survive, the laser cannot target fat. It needs to target something else. It needs to target water. And we have water everywhere, especially after we tumesce the fat layer. Right? If you look at the absorption spectrum of water and fat, you'll see that 1470 nanometer is extremely well absorbed by water and they're poorly absorbed by fat. So you don't actually need very much energy at all to heat up the water without damaging fat. And when you do heat up the water, the fat cells actually gently separate from the surrounding tissue. So now we can easily and harmlessly extract them and harvest the fat cells intact and alive. In the end, we have approximately 95, 96% of the fat that you extract are going to remain viable. So since so little energy and so little heat is used, we decrease trauma, we decrease the risk of injury. Are there other laser-assisted lipo devices out there? And as I mentioned, the answer is yes, but it's a very, very different beast. Let's look at the comparison between a standard bare fiber on the left-hand side, used by other brands of laser-assisted liposuction, versus a BeautiFill laser fiber on the right-hand side. A bare laser fiber has extremely high power density, over 3,500 watts per centimeter squared, concentrated at one spot at the very tip. So you have a high risk of perforating tissue and perforating organs. The BeautiFill fiber needs very little energy to do the work for the reasons I explained earlier. Only 10 to 40 watts per centimeter squared. So a huge difference, 40 versus 3,500. And you can see that the fiber tip is actually rounded and shaped at the very tip, which has a very different laser emission pattern. This allows for energy to be dispersed radially and not focused on one spot. It is also encased, you can see on the right-hand side, encased in a glass encasement to diffuse the power density even more. The entire fiber construct is then inserted and protected by a steel cannula for additional safety. So it really is an awesome technology that increases both the efficiency and safety of fat harvesting. So instead of frying and cauterizing its way through fat like every other laser, the BeautiFill device lasers and suctions simultaneously, gently plucking the fat cell from the surrounding tissue intact and alive. I'm going to show you a study that speaks to the viability of fat from manual liposuction versus BeautiFill. There's a comparison. I thought it was a very convincing study because it was actually a split body study. They took 10 patients, half the body treated with using manual liposuction, and the other half treated with BeautiFill. Right away, if you compare the quality of the fat here, you can see a distinct difference in the quality of the fat. On the left-hand side, from mechanical liposuction, you can see there's a lot of junk. Right? You have a thick oil layer on top. That's the really orange layer on top. And then on the bottom, obviously, you see a thick layer of blood. So the actual usable fat is only about 60%. On the right-hand side, you'll see the BeautiFill fat, which really is beautiful because it's about 99% fat. So your next question should be, okay, so you got a bunch of fat. How do you know it's alive, right? So they went after and answered that question. So I'll give you, this is the viability study, and I'll give you a second to study these numbers. Now, you can see that clearly the BeautiFill numbers are really good, extremely high and consistent viability at an average about 95.7 or 96%. Manual liposuction on the left-hand side, much lower viability, on an average about 80%. So there's already a difference in average. But what really troubles me is that even more is the inconsistency from mechanical liposuction. What if you were patient number 4 with 50% viability? What if you're patient number 5? What if you're patient number 7 with 55%? the unpredictability of that is going to lead to inconsistent results and unhappy patients. So with low energy, gentle laser, we achieve efficient atraumatic lipo harvesting. You have less blood loss, you have less bruising and swelling, you have shorter recovery time for the patient. And remember that 1470 nanometer targets water. Well, water is everywhere. Water is even in the dermis. So after you remove the fat, you can actually use that wavelength to heat up the dermis from the underside and contract tissue, which is a additional function of BeautiFill that we haven't even discussed, but it's really beyond the scope of today's discussion. But it's something that you should hear about more in the future. So armed with all that knowledge, I went back to my clinic and I did my first case the week after the training. Well, and once again, all this is done with the patient awake in an ordinary examination room. And really all you need is an exam table that lays the patient flat and some sterile drapes, really. You don't need a fancy OR for this. There's no need for IV. There's no need for general anesthesia. I have one nurse helping me during the process, and Alma, the company, will supply all the tools I need. And here you'll see my progress. First case, second case, third case. I sort of break it down into 3 steps. We infiltrate the tumescent anesthesia. We harvest the fat, and then we graft the fat. In the first case, I took out 100 cc's and injected 40. Second case, I took out 100 cc's and injected 25. The third case, I took out 75 cc's and injected 45. And that was going faster and faster with every step, and doing larger and larger volumes of injection in the same amount of time, under 2 hours. So let me show you some of my patients. This is my very first BeautiFill patient. And a few points I want to make here. If you have a BeautiFill device and with the proper technique, the downtime can be very minimal. Even after 24 hours, you can see there's 0 bruising, maybe a little bit of swelling around the cannula puncture site. Good fat, good technique, good patient selection is key. Now, you can focus on lifting of her cheeks or the improvement in the nasolabial fold, the contour of her profile as you look at her from the side. But more importantly, I invite you to really take a step back and examine the 2 pictures from a little bit of distance. I want you to take in globally how much younger and rejuvenated, how much glow she has in her skin, and look at the OG curve of her cheeks. Unlike fillers where we're addressing isolated subunits, this looks so much better and more natural because we're able to address the entire face as a whole because we now have unlimited amount of fat to use. And even though we put 14 cc's of fat in your face, nothing looks overfilled because I do believe that fat just lays down and conforms to our natural structure and integrates into our skin so much better than synthetic fillers. And again, this is 14 cc's of fat. And this procedure, for me, I charge $6,000. If I try to do the same with filler, 14 cc's of the most inexpensive filler I have in my clinic, would have cost the patient about $8,400. Even in Chicago, no one's going to pay that for 1 year of results. But here, for $6,000 with BeautiFill, she gets a natural, full face correction that is going to last her for years and years. And this is my second case. And, on the left-hand side, you can see that she already has beautiful bone structure. But their problem is that she works out so much that she looks gaunt and she looks drawn out, in her own words. Again, BeautiFill allows for pan-facial volumization, not just regional, not just isolated improvement with fillers. And again, I invite you to take a step back from a bit of a distance and look at her whole face. She just looks more energized, she looks brighter, and she looks younger. And people ask me all the time, where did I put the fat? Well, the answer is everywhere. This is like laying down a soft comforter or a soft blanket over the entire face. Every feature is improved. All the demarcation between the facial subunits are softened. The temple flows into the cheekbones, flows into the cheeks, which flows into the jawline, that flows into the chin. That's the hallmark of a young face versus an old and weathered and saggy face, because where there are shadows and lines separating every part of the face. And she was very happy, obviously. And if I tried to do the same thing with fillers, it would have been approximately a $15,000 procedure for what? For 1 year of results, and that's absurd. Once again, it's easy to sell this idea of fat transfer to patients when I can say that I can give you this improvement for many years to come for the price of 7 or 8 syringes of temporary fillers like Juvederm or Bristol. This is an interesting case, and first off, you can see that this is probably not the ideal patient. Here we're challenged with fairly severe skin laxity. But even in this situation, we see a global change anchored by what's the improvement in the medial cheeks, the lateral cheeks, the temples, even the lines around her mouth, lower face, and chin are much improved. She's also had many fillers over the years, and she honestly said that this did more for her than all the other fillers combined. Now, for her, this is a larger case. We did have to use about 45 cc's of fat in this case, and yet everything looks natural. Nothing looks overfilled. If I had to put 45 cc's of filler in her, which would have been completely unreasonable. It would have cost her over 27 grand. And for a minimally invasive procedure, where the patient stays awake, where this is done in a clinic room and not in a hospital OR, where we don't need IV, where we don't need general anesthesia, I cannot think of another procedure that's so transformative as BeautiFill. Now, what about buttocks? Well, it does take a little bit more time because now we're moving larger amounts of fat, typically 300 cc's or more of fat per cheek. So typically the fee is higher. Now, what is in vogue now is using Sculptra for quote-unquote butt lift. Now, I would argue that yes, it does make some textural improvements and some very subtle amounts of lifting, augmentation. But I would argue that you would need more than 50 vials of Sculptra to get results close to this. And even then, that's still a stretch. And I'll argue that there's no way that 50 vials of Sculptra can even get close to the results of, let's say, 350 cc's of fat per cheek. And yet, with 50 vials, you would have to mortgage your home to get that 2 years of results on Sculptra. Now, the key here when lifting and filling the buttock is to make sure that you're not simply adding to the volume of the buttock itself, but you're at the same time subtracting volume from the area surrounding it. So you're going to give more contrast and more projection to the buttocks. So, in summary, these are my top reasons for adopting BeautiFill for fat grafting. Number one, BeautiFill is going to give you gentle fat harvesting with high viability, which typically leads to long duration of the fat transplant. Number two, when the results are consistent, as we saw in the study, we're going to have consistent, happy patients. And number three, if all I want to do is fat grafting to the face, which I do most of the time, it is a quick procedure to harvest a small amount of fat with a high return on investment for your time. Number four, with BeautiFill, it is an all-in-one device. I don't need 5 different devices. The patient is awake. I can do this in a regular dermatology patient room I don't need a large OR or a fancy setup. And number 5, as I said this before, it allows me to stand out from the crowd of aesthetic injectors. I can now offer a solution for those who want pan-facial large volume correction, which I was not able to do without breaking the patient's bank. And now, after having done this for about 3 months now, this is my top 5 advice for those of you who are curious but not quite sure if you can do it. My first advice, don't be scared. I'm not asking you to do a large 4-hour liposuction case. I need you to think about spending 30 minutes to take out 100 cc's of fat. I watched it once, and I came back, and I started doing it myself the next week. If you have any surgical experience, if you're a general surgeon, if you're a dermatologist, if you're an ENT surgeon, if you're OB-GYN, this is an easy adaptation for you. Do not be scared of the fat harvesting part of it. If I can do it, really, anybody can. And number two, do take the training seriously. When you purchase a BeautiFill system, Alma will set you up with a training course to make sure that you're completely comfortable with every part of the process. The tumescent anesthesia, the lipo harvesting, and the fat injection. Number 3, start small, meaning that you start with a small amount of area to harvest, maybe the abdomen, maybe the donut around the belly button, maybe the flanks, and start with injecting the face. Really, all you need is certainly less than 100 cc's. Then over time, you can advance to larger areas like the buttocks. And do take your time with the first case. Slow injection, small aliquots. Right? There are some key differences between injecting fillers with the cannula versus injecting fat with the cannula. And I'm happy to talk about that if somebody is curious. But there are basically 2 keys to good outcome. It's the combination of good fat, which BeautiFill will give you, and good injection technique that will allow for long-term fat survival. And number 4, don't overfill. Some of it will reabsorb, and we understand that because there's still a little bit of fluid in the fat. But it's better to do a touch-up a year later than to have to deal with excess fat. Okay? And lastly, your staff is key. They need to be trained to assist you throughout the entire procedure. Now, hopefully, they'll be trained to do tumescent anesthesia for you as well, and that will make your day go much smoother. Okay. And that's it. Thank you for listening. And I think we still have some time to take some questions.
Yes, thank you so much, Dr. Hsu. And we do have some questions. And the first one I was relating to looking at fillers versus fat transfer. Are you generally treating patients who are seeking fillers or who are currently getting fillers, or did you find new patients who specifically wanted fat transfer?
That's a good question. I get that a lot. I mean, the answer is actually both. I do feel that there is a subset of patients who have received multiple syringes of filler year after year for large volume correction, and the expense is adding up, and they're honestly never quite get the results that they need. So this concept of filler fatigue is very real, and these patients will very easily convert to fat grafting, where they are able to receive full phase pan-facial correction that will last for years. And on the other hand, there are patients who right off the bat have avoided fillers because they don't want synthetic products, and they're attracted to the idea of natural volume correction using their own fat. And then there's, of course, patients who are looking to enhance their breast or buttocks, where fillers in general are not feasible.
And how labor intensive is the harvesting part of the treatment?
It really isn't. If all we want to do is correct facial volume loss, which is typically 50 cc's or less, harvesting 50 cc's from the abdomen or flanks usually takes me less than 20 minutes.
And we had a question here about post-procedure care and pain management. Do you use anything for these patients for pain management after the procedure?
Good question. Well, first of all, we don't need general anesthesia for BeautiFill, and that's why this makes so much sense for office-based physicians. Local tumescent anesthesia is used for fat harvesting. And for fat reimplantation, I only use a small amount of lidocaine to numb the cannula puncture site. Now, I do offer Ativan to some patients if they seem nervous, but half the time the patient don't even take that. In fact, it's such a easy process that I've had a few patients who, after the procedure, they immediately hop off the table and drive back to the office to continue their workday the very same day.
Wow, and there's another question here that relates to that. They're wondering, what is the post-procedure protocol for patients, and what is the average recovery time until you see the final results and they feel back to normal?
There's typically some swelling to the face that subsides in 1 or 2 days. Bruising, again, with good technique, with the right patients, is minimal to zero. So they can actually be socially active in a couple of days after the procedure. The donor site, typically, again, the abdomen or the flanks, will drain some excess tumescent fluid for about 24 hours. And they will need to wear a compression garment for several days after the procedure. So they may be a little sore for maybe, maybe after a week, but they can certainly return to active exercise after 1 week most of the time.
Terrific, and that covered the questions we have. If you have any further questions, you can certainly reach out to Dr. Hsu or to Alma Laser through MedEsthetics. And if you want to share this or go back and review any of the information, the webinar will be available at medestheticsmag.com/webinar within the next 2 days or so. And thank you so much for joining us. And Dr. Hsu, thank you so much for your presentation.
Well, thank you for your time, everyone. Thank you.